Are you looking to grow your dental practice and attract top-tier new patients? Discover the potential of digital marketing with a personalized strategy session. Join Lila Stone, the marketing director at Equa, for an exclusive 90-minute consultation. Lila and her team will dedicate 6 hours before your meeting to create a customized marketing plan specifically for your practice. This valuable opportunity is free of charge and comes with no commitments. Visit www.insuranceuntangledorg/MSM to schedule your meeting with Lila today. You'll also receive a free analysis report so you can start transforming your practice through the power of digital marketing.
You are now listening to another episode of the Insurance Untangled Podcast, where we explore the various challenges faced by dental practices due to their reliance on insurance. Join us in this podcast as we dive deep into the issues surrounding dental insurance dependence and offer practical solutions and strategies to help you take control of your practice's financial future.
Hello, everyone, and welcome to another episode of the Insurance Untangled Podcast. Today, we're exploring one of the biggest shifts happening in dentistry, the move from simply treating teeth to understanding how oral health connects with breathing, sleep, airway health, and the rest of the body. For years, dentistry has primarily focused on restoring and repairing problems after they appear, but a much larger opportunity is emerging. Dentists are in a unique position to recognize warning signs that may be connected to sleep disordered breathing, airway issues, and a patient's overall health. Millions of people struggle with sleep-related problems, yet many never receive the right evaluation or treatment. This creates an important opportunity to improve patients' lives while also helping forward-thinking dental practices build a more valuable and sustainable model of care. Joining us today is Dr. Dara Radfar, also known as Dr. Rad. Dr. Rad is a dentist, educator, speaker, and advocate for integrating sleep and airway services into modern dental practices. Dr. Rad, welcome to the Insurance Untangled Podcast. It's a pleasure to have you with us.
Thank you for having me on, Angie. I'm excited to have the listeners listen about sleep, how they can sleep better themselves, and maybe if they're dentists or dental professionals, how they can help their humans and patients in the practice.
Definitely. Now, this episode is brought to you by Equa Marketing, the digital growth partner behind this podcast and a trusted resource for dental practices looking to attract the right patients and build stronger, more profitable practices. Dr. Rad, let's begin. Now, dentistry has traditionally focused on treating teeth, but you're passionate about a much bigger vision of patient care. Why do you believe the future of dentistry is moving towards sleep, airway, and whole health dentistry?
Sleep apnea and not being able to breathe well at night has a slew of effects on your dental health. And we're talking bruxism, we're talking dry mouth issues. Therefore, if there's more dry mouth, there's more cavities, there's more periodontal disease, even a higher risk of oral cancer. And the dentists and the hygienists and the team are primed to look in the mouth, right, for cavities and periodontal disease and oral cancer every 3, 4, 6 months. We're also can look in the mouth now and be able to see these red flags that can say, hey, is this patient sleeping well? Are they breathing okay to be able to get enough oxygen? So as a dental professional, if we could find out what those red flags are, at a minimum, we should have that conversation to be able to screen that patient and hand them off to a sleep physician in the community. But since 2010, when the oral appliance was put on the map as effective therapy and treatment for sleep apnea, an alternative to CPAP, now as we have an opportunity in any dental practice to be able to make a mouthpiece to help most of the patients that are diagnosed with sleep apnea. So the question becomes, how do we get the systems in place? And that's what I've done as much as I can over the last 14 years of teaching this stuff to other dentists, is systems, the training, the home sleep testing, the medical billing, all the pain points that that doctors go through. But we are right now positioned in a dental practice to do such powerful work to be able to save lives, improve the mental and physical health, improve relationships for patients, meaning they can sleep next to a bed partner and not have the worry or the embarrassing moments of snoring, and ultimately help them with also their mindset. It's very hard to have a positive mindset when you're not sleeping well.
That definitely changes the way we think about the dentist's role in a patient's overall health. Now, many dentists have heard about sleep apnea and airway dentistry, but they still see it as something outside their traditional scope of practice. Why do you think so many dental practices are overlooking this opportunity, and what are they missing?
So a lot of times dentists are worried that they can't diagnose sleep. And that's true. You can't diagnose it as a dentist. You have to have a board certified sleep physician from a home sleep testing company that you as a dentist can refer to, and they will diagnose it for you and send you the results. So that's been kind of the pushback. And then the second is, what do I do with the medical billing? Patients are not going to do this if I don't know how to do medical billing or bill the insurance. Well, that's why we have a third party that can do that for you. But at the end of the day, Angie, I ask you, would you still treat a patient or screen them if there's no insurance coverage whatsoever? Do we do that in other aspects of dentistry when a patient wants or is a good idea to have clear orthodontics like Invisalign or even traditional orthodontics? We still do that and there's no dental benefit. Or the insurance maximums in dentistry are $1,000 to $3,000, let's call it $1,500 on average, and we have 3 crowns that we need to do. 1.5 crowns are covered, and then the other 1.5 are not. Do we still not diagnose it? Do we still not plant the seed at a minimum to say that this is what's going on? If the patients decide to wait on it because of insurance, then they decide to do that. But we still do our job, and I think the limiting belief is because medical insurance, I don't know how to do it, or because I don't have the right systems in place, which are really easy to do. And that's part of the program that I put together so that everybody can get screened. A third of our patients that walk in, that means if you have 20 patients in a given day from hygiene and all the things that we do in a dental practice, 20 patients that walk in, 6 of them are potential candidates for sleep apnea. And so if you could look in the mouth and look in the medical history and be able to identify those red flags, you can have that conversation with the patient and ultimately get them referred for a sleep study and then treated.
It's definitely that is definitely such an important point. Now, before we continue, I'd like to take a moment to thank the sponsor of today's episode, Equal Marketing. One of the biggest lessons from this conversation is that growth often comes from recognizing opportunities that already exist inside your practice. You may already have the patients, the team, and the clinical potential, but without the right strategy and systems, those opportunities can easily be missed. If you're listening and wondering where your practice may have untapped growth opportunities, whether that involves attracting the right patients, strengthening your internal systems, or building a clearer long-term strategy, visit insuranceuntangled.com/MSM. There, you can book a complimentary marketing strategy meeting with Equal Marketing team. The session is designed to help you identify what may be holding your practice back and create a clearer path towards sustainable growth. Once again, visit insuranceuntangled.com/MSM to learn more. All right, now let's return to our conversation. Dr. Rad, for dentists who want to introduce sleep or airway services into their practices, what does that transition actually look like? What systems, training, and mindset shift needs to happen for this to become a successful and responsible part of their practice?
Yeah, so a comprehensive course, such as, I provide one, it's a 5-hour online training for the doctor. And then I require, yes, I use that word require, for the hygiene team to be able to also look in the mouth and know what to look for. And that training video is about 25 minutes. And then they can have that conversation in the chair and then hand it off to the doctor. So first is the training, and then once you learn what to do and how to do it, which appliances to make, and all the systems that are in place, the CPAP affidavit, the informed consent, the financial arrangement forms, all those are provided. Now it's referred to the home sleep testing company, and we have one that I've been working with since 2014. They will take the order from the dentist for the patient. They will call the patient within 24 to 48 business hours, let them know if there's any copay for their home sleep study. They'll send them the equipment. So the dentist waits for the sleep study to be done. And then within a couple business days after the patient's done, the sleep report is emailed to the dentist and the dental practice with the diagnosis by the board certified sleep physician, with the apnea score, as mild or as severe it could be, the written prescription for CPAP, oral appliance therapy, or surgery is given for the doctor. And then they can go ahead and go over the financials, have the medical billing company that I set the doctors up with pre-auth the appliance if we choose to bill medical, and then ultimately do the appliance if that's the choice of treatment for the patient.
I'm so glad you clarified that, because this is not simply about adding another item to the treatment menu, right? It requires collaboration, training, and also a proper patient care pathway as well. So one of the biggest challenges dental owners face today is increasing profitability without simply seeing more patients, working longer hours, or becoming even more dependent on insurance. How can services such as sleep dentistry help create a stronger and more sustainable practice model?
I look at a company like Subway, which is a sandwich place that is a chain sandwich place worldwide, actually. And several years ago, they ended up opening up a few hours earlier and just providing breakfast sandwiches. They already had the business open, right? They have a customer following base, but now they added another product. They didn't have to necessarily open more businesses. They didn't have to necessarily do many things to be able to add this to the menu. And sleep is just another thing you can add to the menu because you're already open. You already have your staff. There's no additional staff that's needed for this. If anything, it's a lot easier on your neck, on your back. I have a lot of doctors that are transitioning out of clinical dentistry due to physical ailments. Sometimes it's mental burnout. You're injecting a 30 gauge, some 27 gauge needle into someone's face and doing crowns and all these implants and all this training that you had to do a little bit of a invasive dentistry or surgical procedures. The sleep apnea is a very non-invasive treatment, and the bite changes can be mitigated. People give me that limiting belief. Oh, the bite. Well, how about the fact that 7 to 15 years off someone's life if they're not being treated for it? Or the fact that 5 times higher risk of cancer of any kind. A University of Wisconsin study came out several years ago for untreated sleep apnea. So you already have the patients coming in through the office and into the chair. All you got to do is screen, ask the question, and if the patient says, "Oh, I sleep great," even though you see those red flags in the medical history and in the mouth that indicate sleep apnea, plant the seed just like you do any other procedure, and move on. Give them the risk factors. Maybe give them a brochure. We already give those brochures to my docs to be able to hand out to patients, educational brochures, and educate them. And eventually they'll be coming back. They'll sit there in their 3, 4, 6 month checkup appointment and be like, "Hey, doc, I remember you told me about this, sleep thing. And my girlfriend or my husband kicked me out of the room a couple months ago. Apparently I'm snoring now. What do I do about that?" I mean, why? Because you planted the seed that you're doing this in your practice. I was once taught by a friend of mine, Elijah Desmond, closed mouths don't get fed. So if you want to go to your practice and get fed, you got to open your mouth and share the knowledge about anything that you do. Don't worry, the patient's not going to leave you because you talked about how well they sleep at night. They're not going to think that you're selling them something. If you come from the heart and you show that you truly care, because you see now through continuing education, the risks and the problems that are associated with certain things in the mouth that can indicate sleep apnea issues, a patient will truly actually realize how beneficial you are to them, because now you're looking at their total health, not just their dental or oral health.
Now, let's look ahead 5 to 10 years. What changes do you believe will separate the dental practices that thrive from those that struggle? And what should practice owners begin doing today to prepare for that future?
There's about 200,000 dentists apparently, or dental practices in America, and roughly around 3,000 or so are doing sleep consistently. I posted something on Facebook several months ago that got a lot of pushback. And I said, if your dentist isn't asking you how well you sleep at night, you may need to find a new dentist. And I got a lot of people upset at me saying that. And the reason is look, in 2009, I fell asleep at the wheel. I crashed my car into a tree, not knowing I had sleep apnea. It's a possibility that someone could have looked in my mouth and prevented my accident. And I don't play victim to the accident that propelled me to being in front of you today and helping 4,000 plus patients in my practice for sleep apnea and training over 4,000 dentists worldwide on how to do this because of my experience of my car accident. But in 5 to 10 years, I'm hoping that majority of dentists are at least required to screen for sleep apnea. The American Dental Association already put out a guideline in 2017 that dentists and team members should be screening for sleep and sleep apnea. But I'm hoping that is a requirement just as much as it is a requirement to find out for cavities and oral cancer and gum disease. So that's the goal, is even if you don't treat it, like I don't do, root canals. I don't do gum grafting surgeries. I don't do full bony wisdom teeth with sedation. I have a nice little business card for the doctors that do, and I give that business card every time I see it that a patient would need that. The same concept with sleep. I'm hoping in 5 to 10 years, every dentist will see it. At a minimum, provide a business card to a sleep physician, or they can handle it themselves through the proper training and through the proper systems that we put in place.
Dr. Rad, this has been such an insightful conversation. The future of dentistry is clearly expanding beyond procedures and production numbers. The practices that thrive will be the ones that understand their patients on a deeper level, recognize problems that may otherwise remain overlooked, and build responsible systems for connecting patients with the care they need. Sleep and airway dentistry represents more than an additional service. It represents a shift in the way dentists think about their role in healthcare and the value they can provide to their patients. Now, before we close, I'd like to leave our listeners with one final thought from you. Dr. Rad, what is the most important takeaway you want every dental practice owner listening today to remember from this conversation?
Yeah, doing sleep apnea screening and treatment isn't for everybody. But at a minimum, we should be able to learn how to do this and hand off to a sleep physician or to another dentist in the community that you trust that hopefully will never steal your patients. I always say, if you want to grow your practice, you want to make a difference, try it for someone that's dear to you. If you have somebody in your family that suffers from sleep or has snoring issues, we all know somebody in the family, or maybe yourself, the dental practitioner themselves, or there's a team member, a hygienist or a hygienist spouse, or an assistant or front office. Make a couple for yourself or for the people around you, and get used and see the benefit of what people are saying to you. Wow, I feel better. I'm sleeping better, and go through the troubles of what happens when you push the appliance too hard and the patient gets jaw pain. I mean, these are the kinds of things that I teach on how to be able to mitigate so that the fear is gone, so that we can remove fear and ultimately help our fellow humans. Because you're the only person that looks in the mouth of a patient a few times a year. You're the only person who can treat it with an oral appliance, which has far higher compliance rates than a CPAP or someone choosing to go into major surgery. And if you're that gateway, that person, look at the power that you have to save lives. And the practices that incorporate this properly, they're making, if money is a motivating factor, which we shouldn't have any money shame, they're making a minimum of 6 figures added to their practice with an ROI of about 8 to 1, because the appliances are about $450 and the average fee is around $2,500 to $3,000. So the money's there. That's not something to be shameful for. You can make a lot of money doing this. but the impact that you have on patients coming back and telling you, man, you made such a big difference in my life. The next time you diagnose an implant, the next time you diagnose a crown for a patient who you helped service sleep for them, or more importantly, for their children, you were able to look in the mouth of a kid and see the signs of bruxism and dry mouth and high arched palate and retruded jaw, and the ability to see the tongue is too big for the mouth, and possibly the kid's not sleeping well, which has a slew of effects on their ADHD symptoms and growth mentally and physically. I mean, imagine doing something like that and referring the kid to a pediatric ENT or doing phase 1 orthodontics to help the child. Those parents are literally looking at you like you've saved their child's life in such a way that they're in debt to you for anything in the future, and they become patients for life. And so, have the courage beyond the fear to do this. You have the courage to inject someone with an anesthetic, with a needle. You have the courage to drill teeth off someone's face as a dentist. Those are not easy things to do. Sleep, the actual dentistry of it is almost as simple as fabricating a night guard. And so, if we can get out of our heads, we can help so many humans sleep better and ultimately be better human beings out there in the real world.
Thank you so much, Dr. Rad. That is a wonderful message to end on. If today's conversation gave you a new perspective on the future of dentistry, visit insuranceuntangled.com/resources. There you can access the resources connected with this episode. And if you're ready to identify untapped growth opportunities and strengthen your practice strategy, visit insuranceuntangled.com/MSM to book a complimentary marketing strategy meeting with Echo Marketing. Don't simply listen to this episode and move on. Choose one idea from today's conversation and take action on it. That is where the real value begins. Dr. Rad, thank you again for sharing your knowledge, your personal experience, and your practical guidance with us today. And to everyone listening, thank you for joining on the Insurance Untangled podcast. Until next time, continue building a practice that creates stronger outcomes for your patients, your team, and your future.
Thank you, Angie. And for those action takers, if you want to reach out to me, go to drrad.net and I will love to help you.